SleepApnea.org presents Portraits, Living with Sleep Apnea, a conversation with Dr. Alicia Chung. Tell us about your research.
My research interests are adolescent behavior change programs to prevent cardiovascular disease, and I've had the opportunity to really explore data. I'm interested in minority youth, and with that, I've been able to work with a population in Brooklyn and look at some of their indicators in terms of hyperactivity and their preliminary baseline data, working with the Parent Corps program and Dr. Brotman's group to really identify early signs for OSA so that we can think of interventions that would kind of preempt anything that might send them on a wrong trajectory. One of the other projects in terms of behavior change programs, we're looking at mobile applications and how do we incorporate sleep, diet, and physical activity so that we're, addressing the holistic person, but also putting sleep at the forefront and having, through what you're doing and putting that awareness out there. I think it's great that you're actually, working with cutting edge researchers and to have access such an extended network of people to have that reach and that potential. I think that's brilliant. There's so many early interventions, especially when you're catching the youth and you're instilling that it's okay to acknowledge your OSA and to wear the mask and take these steps that are needed so that if you need to lose weight or address any other conditions that you need to face, that without addressing the OSA, none of them are even probable of any type of effects, right? So you really have to address that underlying cause, and sometimes they don't even know they have it and they're just kind of misdiagnosed and they're put into this category of they're just bouncing off the walls, they're just being a kid, and they just misbehave, right? And there's really something there that the child may not know how to vocalize or how to express, but they're experiencing something and they need to be recognized for that and given that platform to be recognized. All the work you've done kind of learning for it, I don't think those 30 years are wasted. I think it instilled something that drove you forward to put this organization together and really bringing the parents, the children, and the community together, the school and the work, as you mentioned. It takes those multiple touch points to come together so that the parents are working together in conjunction with everyone else, and then you can actually recognize this issue and then you can ameliorate the stigma and actually kind of take ownership of it and think about, okay, what are our solutions? What are our options? How do we address these needs for our children so they can actually prosper and not try to, shun them for it because they're innocent. That's definitely the direction that we want to go in terms of actually looking into the numbers and having the evidence and having the data to really discern what is justifiable ADHD and maybe there's an underlying cause that's not detected, right? And really trying to um, get out the root cause of that. And in academia, you always need the scientific evidence to support that. And that's definitely where we want to take it in the next phase so that when we intervene with our children at the preschool level, they're set on that right track and they are kindergarten ready and it's social, emotional, and holistically ready for them. So we definitely put that on the forefront of our agenda and what we'd want to do. And are looking at different avenues and partnerships and how we can look to really allocate our children in the right areas for treatment and for the services that need for their best development.
Explain what happens when parents don't think that anything is wrong.
It is the parent, and they take it for granted because it's their normal. It's a custom. This is our household. This is what happens. And then with our obesity epidemic, you just think that the eating habits and everything else is customary and that they're taught in terms of our families, but they can't really address those issues until they've addressed the sleep apnea and everything else, that comes with it. So everything that is a learned behavior, we have to try and interject them in different ways. But there are a lot of times where they're just learning from their parents and it takes a while.
How do you fit treatment around parents' schedules?
Our parents are dealing with competing responsibilities all around, and we are very amenable to their schedules in terms of weekends and nights and going out to them to reach them. So we're very flexible in our time that way, and our staff is great that way. I think having them value the concept of addressing their sleep apnea is sometimes what takes time to have people value that change, right? So over their readiness to change and over time with their preparedness, because they might just feel like I just have to go to work and this is it, right? This is just a byproduct of working. We put a lot of time into culturally adapting our messages, and shift work is an actually important aspect of what we look at in the center. And with looking at what messages best work for that population. So we tested effectively with focus groups and with working with our community advisory board and with understanding what are the best channels to reach them. So it is a concern for us, and we do try and understand what are the best ways to get the message to them.
How do you overcome trust issues in the community?
The fears that are out there, I think that definitely plays a factor into this fear of industry and the healthcare industry as a whole, and really are they invested in my personal interest in my care. And I think that's a bit concerning, particularly given our populations that have maybe newly arrived to this country and may not have the greatest deal of trust. We see that patient mistrust is a big issue in communities of color, and overcoming those boundaries really takes addressing their literacy levels, their concerns, and the history of the healthcare system in America. The dynamic of the healthcare system within this country is very profit driven on one end, and then you have the institutional racism. And when you bring that together for a community that's been historically marginalized for so many years, it is a big bridge to build. And it takes time to have those inroads. And oftentimes it just takes consistency and presence. And over time, if they, give us an entryway to attend your health fair, we build a rapport of trust with an organization. And then our name speaks for itself. So that trickles out by word of mouth, which is the best referral network and recommendation you can go by.
What do you believe your research can achieve?
I see greater awareness, gaining more momentum across different areas. And I see the importance of that field taking a higher precedence. I think that exposure will come over time, and that it'll become something that we diagnose earlier and are not as quick to just prescribe a prescription, right? To automatically write that script. So I think with the projects that you're doing and with the community and the research and the clinical practice forging together, that it'll become more commonplace and more of a household topic that won't be so stigmatized.
What are some other barriers to making change?
There is a badge of honor to how much you can produce on the least amount of sleep. And I really don't see it going away. But I think that the more that we have these apps and these different tools and really putting it out there on the platform and really putting more attention to sleep apnea and to sleep as a whole, and the research is coming out more in the popular press, and they're making more connections in terms of diet and sleep and the other cardiovascular implications. And I think then it's starting to propel to the forefront, where you see other interdisciplinary teams coming together, and then it translates to the public. Then it'll slowly trickle down into gaining more attention. It will take some time, honestly, and especially the way that we function in this country in terms of the work ethic and the way we produce. But at least it's a start. Addressing patient mistrust is a huge platform for us and one of the major projects that I lead here in the center, and particularly for their involvement in clinical trial research. And I think that's the hugest barrier. And oftentimes, the best way you influence sometimes is with the little one, whether it's diet, whether it's sleep. If you can influence that, because the biggest, brawniest man will be a sweetheart when his little child says, it's for them. And you can go through the children and try and influence them and educate them. And that's where it can oftentimes start, is with the children.
Do you have any final advice for parents?
I would say to not take it for granted if you hear your child snoring and to pay attention to the early signs. And if you have any inclination that something is wrong and the drowsiness that you're seeing, to definitely bring them to get the right care that they need early.
To learn more, visit sleepapnea.org. Now,